I remember I was playing some recreational tennis one time, and I had to run up toward the net real fast and put on the brakes, and I felt like I got shot in the calf muscle, by a gun or something. I just dropped. And it turns out there's an actual entity called tennis leg that I found out about later. And a friend of mine who's a big tennis player said, man, you should feel good about having tennis leg. That's like an honor. Yeah. I didn't feel like it was an honor. I was on crutches for about 3 weeks. But, an injury that just happened so quickly, I wasn't really doing anything wrong. I'd warmed up, all those kinds of things, but it still happened. Right. So then you still have to just learn to have a positive approach to that. Make sure you've got a good physical therapist, that you put your hands in, a good sports medicine doctor that can guide you through that. And then you have to just learn to have some patience, but you realize too how much you're chomping at the bit to get back out there. And so when you're treating your own patients later, you realize, I recognize that's familiar to me, that feeling of what this person's having, and I understand how they feel, and I can talk to them. And sometimes you actually even use that. You may tell them about an experience you had that you can share with them. And they understand it, from both sides a little bit better.
I had an injury that I remember, and I think actually played a lot of role in myself being interested in sports medicine, and specifically focusing at the knee. My senior year, I was playing linebacker, and I went to make a tackle in a game, and another player was blocked into my leg, and I felt a lot of pain, and I felt a pop. And I remember being on the sideline and being examined by the sports medicine orthopedist. And I remember watching my knee move in a direction that it normally shouldn't move. And I remember in his eyes, there was a lot of reassurance, and he knew that I was worried about that. And so through that process of then being injured and going through the uncertainty of what does that mean and what is the extent of the injury, and being in the middle of a season and wanting nothing more than to be able to go back out there and not miss any time, that really has always stuck with me. And that kind of heartache, and it's not just the injury, it's a lot more. It's the emotional aspect, the mental aspect, and to all the people that helped guide me through that, I did a lot of rehab, all of the rehabilitation, and what it took to get back on the field. So I've always remembered that, and I often think about those emotions that I had when I'm treating athletes that were injured, and how big of a deal that it can be to work through that.